Chudi the convener of this amazing group. Thank you and welcome to my clinic this afternoon. This afternoon, we're going to talk about the practical ways of treating vaginal dryness among women that are believing God to become mothers. So, if you currently suffer from vaginal dryness, you can agree it's a very discomforting experience. It would definitely affect everything about your relationship. There are a couple of direct impact of this particular topic on women. So please, when you join today's clinic, I need you to introduce yourself. So let me know who you are. My name is Dr. Chudi Ufondu. I'm the convener, and I'm going to help you to understand the practical steps you can take so you can have relief. So we're talking about vaginal dryness among intending mothers. So please, when you join, let's know who you are. Let's know where you're located. Confirm you can see me, type in a comment. And as soon as I have a good number, I'm going to start. I plan to spend about 20 minutes, but it's going to be dependent on the number of questions I have in the clinic. Now, my first few minutes is going to be on explanation. So I'm going to take time and give my presentation. Then afterwards, you will have opportunity to ask your question. I'm going to start. So here's the deal. There are some factors you can control in the reproductive system of women, and there are some factors you cannot control. Now, by default, there are some hormones in the body of a woman which maintains everything that makes that lady a woman. One of those hormones are the hormones that makes it possible for the vagina to be wet, for the vagina to be moist, so that in course of sexual intercourse, it will not be painful, you will not have bruises, you will not bleed. The chief hormone is estrogen. So estrogen is the reason why when you desire your partner at the peak of sexual intercourse, you are ready. You are not in pain. Your vagina is not dry. Now, as you are getting older, the level of your estrogen will be reducing. And when the level of estrogen is reducing, by default, you will start experiencing vaginal dryness. So vaginal dryness will occur mainly in women that are getting older. Now, fortunately, the fact you have vaginal dryness doesn't mean you can still not be able to start your family. So majority of women that want to start their families will start planning for their families between the age 20 to age 50. But as you're getting older, especially as you're older than 35, you will notice gradually that you've started experiencing vaginal dryness. Now, that type of vaginal dryness is from natural cause. It's age related. It's not based on whatever you've been doing. It's not something you can control. Now, there are other reasons why you might also have vaginal dryness. Vaginal dryness can also be a sign you might have inflammation. It might also be a sign you might have some infection. It can also be due to side effects of some drugs. For example, the popular fertility drug that is grossly abused, which is Clomid, when it's consumed without prescription over time, it can dry your vagina and you can experience vaginal dryness. So vaginal dryness can also be consequences of using drugs you're not supposed to use. So it can be natural, it can be age-related. For example, a woman that started experiencing vaginal dryness at age 50, by default, it's possible the reason why she's experiencing that vaginal dryness is related to the fact that she's perimenopausal or menopausal. So when you go into menopause, you no longer have that ability to become pregnant. So by default, as women are aging, they will start noticing changes in the vagina, including what we call atrophy. So atrophy means the cells in the vagina will begin to be reduced. You will begin to notice some changes in your vagina, including dry vagina, including painful intercourse, including spotting, including bleeding. They are all expected. Now, if you have infection can also present with vaginal dryness. Together with vaginal dryness, if it's infection related, you will also experience itching. Together with itching, you will also experience pain during sexual intercourse. So medical terminology for pain during sexual intercourse is called dyspareunia. Some women will also experience pain during urination. Some women will also experience spotting or frank bleeding. Now, the big question is, if you want to have a baby and you are expected to make love regularly and you're experiencing dry vagina, what is the remedy? How can you engage in everyday or every other day lovemaking if you have dry vagina? Is it going to be enjoyable? Of course, it's not going to be enjoyable. It's going to be very discomforting. It's going to be painful. You're not going to like it. So the question is, when you have dry vagina, should you give up hopes of starting your family? No. There are a couple of things you can do to increase your possibility of improving the moisture in the vagina. We're going to talk about the natural approach first before I will recommend some tips. You have to increase your fluid intake. So if you're not someone that naturally loves drinking water, you have to drink a lot of water. So the more hydrated you are, the more it's going to be distributed to the vaginal area. So you have to form the habit of drinking water regularly. Now you have to eat properly. There are so many food items that contain high level of water, like your fruits, your vegetables. Now you have to avoid alcohol. Now, ultimately, when you do all this by default, the possibility that your vagina will begin to look better is very high. Now, depending on the likely reason why you have vaginal dryness, for example, if vaginal dryness is because of sexually transmitted infections or urinary tract infections or any other form of infections, when we identify that infection and we treat the infection appropriately, you will be relieved of the vaginal dryness. If your vaginal dryness is also due to some systemic problems, then we can also apply some treatments in that regards. When we come to the medical treatment of vaginal dryness, remember what I told you about the estrogen. So if the reason why your vaginal dryness is there is because you have reduced number of estrogen in your vaginal area, we can prescribe some vaginal cream, vaginal estrogen cream, which can be controlled. We can also prescribe some lubricants. Now, the vaginal moisturizer or vaginal cream must be prescribed by your provider, especially if it's estrogen related, so we can monitor that. Now, besides that, naturally, there are so many helpful lubricants out there. If you want to have your babies, if you still want to become pregnant, there are some lubricants you must avoid. It's not all lubricants you use. There are some lubricants that are not friendly to the sperm, so you have to be on the lookout for the two types I'm going to mention. The first one is press seeds or baby dance. So if you intend to become pregnant and you notice you're having vaginal dryness, especially if you are among the people that practice PPP, remember the month of November, it's a challenge for our members to increase their frequency of lovemaking. So if you have to make love every day or every other day because you want to have a baby and you're experiencing dry vagina, is it going to be painful? Yes. Is it going to be discomforting? Yes. What can you do? Improve your water intake, improve your vegetable intake, improve your fruits intake, but ultimately you can use lubricants. When you're using your lubricants, read the label. Make sure they are sperm friendly. There are two sperm friendly lubricants you can use. You can use press seeds or you can use baby dance. When you don't use these two and the other types which might be recommended by your provider, when you go using oil-based lubricants, they will form a barrier and your sperm might not be able to get your partner pregnant. So be very meticulous in the type of lubricants you're using. Overall, broad spectrum, there are two applications you can use in treating dry vagina. The other one is vaginal moisturizer, which might contain estrogen, which must be fully monitored, or lubricants. So whichever one that works for you, please use it exactly the way your doctor prescribed it. But don't use the fact that you're experiencing dry vagina to stop believing and trusting God for a baby. You can still have dry vagina and you can still become pregnant. So long as you're ovulating and we have availability of the sperm and availability of the egg, pregnancy can still happen. Okay, so that's my quick presentation. And I can see I already have some questions on the floor from Miss Lex. No vaginal dryness, but you're on hormone replacement therapy. Now, hormone replacement therapy, it's a procedure where we notice that your natural hormones are not within the normal range, so we can replace those hormones artificially. Commoner hormones we can replace artificially are estrogen, progesterone, FSH, LH, and other forms of hormones out there. Now, expectedly, anytime we're introducing external hormone into the body, we have to monitor it religiously. So there are some of them that might disrupt your cycle. There are some of them that might have a couple of side effects. So if you're currently on hormone replacement therapy, possibility the combination of hormone replacement therapy you might have that contains estrogen and progesterone is very high. So it's possible that the two combo of hormone replacement therapy they will place you on will be the hormone replacement therapy that will contain progesterone and estrogen. And thankfully, progesterone and estrogen are very helpful in maintaining the vaginal mucosa and also the womb mucosa. Okay, since you've been on HRT, your estrogen patch and progesterone, okay, your period has returned. You don't know how to interpret that. So remember, this is not a trial and error thing. When you don't understand, you go to your doctor. Anything related to hormones, anything related to having a baby, anything related to pregnancy, anything related to medications, anything related to drugs, please don't go about it your way. It's not meant for you to understand, to interpret. Interpretation is meant for your provider. So if we tell you to take a drug for 1 week, and in course of taking it within that 1 week, you notice some side effects or some consequences or some adverse effects, ring your doctor. Don't stop or start a drug or medication by yourself because of what you feel. That's not a good practice. So, Miss Lex, go to the gynecologist that recommended these two combo of replacement therapy. He's going to evaluate you and he's going to tell you what to do. And you're 39 years, so you need to be careful, okay? If you continue to have periods on hormone replacement therapy, it's safe to say you've moved away from menopause. Well, there are criteria we normally use in diagnosing menopause. The first criteria is absence of your period for a consecutive 12 months. So if for the past 12 months, even at this age 39, you have not bled consecutively, until proven otherwise, you've gone into menopause. Now, majority of women will start experiencing menopausal signs from age 40 up. But if you develop menopause before age 40, it's called premature ovarian failure or preterm menopause. So menopause is not top of my list. You are 39. What I will advise you to do is to go back to your doctor. Now, definitely, I'm not going to recommend any marker route for you. I'm not a proponent of herbs. What I will tell you is to be careful. I'm sure you have a gynecologist or a fertility specialist. So form the habit of running everything you take into your body by your gynecologist and by your fertility specialist. So I'm not going to recommend marker routes. There are so many claims out there that it will do this, it will do that. But personally, I don't recommend that. Okay? If you have any other question, please feel free to ask. So I'll provide you feedback before I go. Thank you for attending, Miss Lex. It looks like you're the only person in the clinic this afternoon, which is okay. If you have further questions, make sure you attend. Make sure you ask your questions. And if you have access to the new course, make sure you buy the course. Make sure you get subscription for packages you need. And the month of November will be devoted to gender selection and gender determination. So if you've always wanted to have a baby boy, a baby girl, or if you wanted to balance your family and you've not really been successful, the last Sunday of November, we're going to talk about gender selection, gender determination. So you don't want to miss that event. I personally want you to attend with your partner so you guys can talk extensively about your family balancing. All right? Do we have any other questions? In the absence of any other question, I'm going to quickly close the clinic. It's about 14 minutes. Correct. Yeah, Miss Lex, just save the last day, the last Sunday of November, and you will not have any regrets. So if you wanted to have a baby boy, a baby girl, and it's not really been happening your way, there are medical ways you can achieve that. So I strongly recommend you register when the registration starts. Hopefully registration is going to start over the weekend, and you make sure you register, and by the grace of God, we are going to attend to you. So thank you so much for coming this afternoon. I appreciate you, and I hope to see you guys. My next clinic will be on Tuesday, 6:30 p.m. Eastern Time and 11:30 p.m. Nigerian time. So I hope to see you guys on Tuesday. Remember, tomorrow, if you're in America, we are going to fall back by 1 hour. So we're going to lose 1 hour tomorrow. So be very mindful of that adjustment so that the clinic period will also follow same. So most likely, starting from tomorrow, our clinic will start from 12 p.m. still, but we're going to lose 1 hour. So that means people in Nigeria will likely be in the 6 p.m. time frame, no longer 5 p.m. So I'll see you guys tomorrow and enjoy the rest of your evening. God bless you and bye-bye.